And so through my experience teaching these type of events, teaching on university PWP and CBT training courses, and working and managing IAP services, in speaking to clinicians, the most commonly reported issues as to why people feel they run over time are these two. So either the patient is as what you would classify as oversharing, or they're going on tangents. And what I mean by that is that they're giving you more information than you actually need for the purpose of your session. Like I said, we're not blaming the patient for that. It's not their fault that that's happening. But either way, there's an excess of information coming in. Or the complete opposite. So the patient is undersharing. So they're not giving you enough information. We've probably all had patients, I know I definitely have, where you'll get back those kind of like one-word answers or really short statement responses. And what then happens is, because you're then having to ask the questions in lots of different ways, it actually then means your session ends up taking longer. So we've got these two elements here, I guess, your oversharing and your undersharing patient. And so one of the things we can think about is what's leading to that happening. And this is really important. It's not about just kind of like putting a plaster on top of it and moving on. We want to look at why this is happening within our session. So we're trying to dig to the bottom of it. There are so many different ways you can do that. The one I'm going to briefly talk to you about today is a model by Michi et al. Called COM-B, which some of you have probably heard about in your training. If you haven't, it's a really good model I'd look at, and the slides have a reference list which you can go to. I don't have the time, I could spend a full hour talking about this, but just to give you a very brief overview, this model, COM-B, is basically looking at why we do certain behaviours, why certain things happen. So you'll see on the right-hand side, you have behaviour. Behaviour could be anything. So it could be oversharing or undersharing. It could be doing homework. It could be attending sessions. And according to Michi et al., the three factors which play into whether that behaviour takes place are capability, motivation, and opportunity. I'll give you a very quick overview, but basically capability factors are factors which are internal to that person, that patient. So for instance, there could be like psychological capability factors. Does the patient understand what you're asking them? Do they understand the way that your modality of therapy works? Are there any kind of learning difficulties or needs which you maybe need to take into account? These are all capability factors. We also have physical capability factors like mobility issues. Is the patient able to do X homework based on their current mobility or their physical health, for instance? So those capability factors are internal to the patient. We've then got opportunity factors at the bottom, which is easier to think of those as external to the patient, to the world around them. So in their kind of environment, what is making it more likely or less likely that that behaviour will take place? So that could be things like the people they have around them. So we know that if people have supportive, if patients have supportive people around them, they're more likely to get positive outcomes in therapy. If the patient has never seen like a positive role model of therapy, they maybe come from a community that doesn't believe in therapy or doesn't believe in mental health practitioners, that would be a barrier that would come in their opportunity, which would mean they may be less likely to attend their therapy sessions or engage with you. They feed into your motivation, and we're going to talk about motivation a lot more later on. But basically what you need to think about with this model and take away from this slide is that we have these capability and opportunity factors, so these factors internal to us and external to us, which can either help us to do certain things or get in the way of us doing those things. So for instance, with attendance of therapy, for example, a really good opportunity factor is if the patient has positive role models of therapy. Whereas, like I said, a barrier to their opportunity might be something like they've never experienced therapy before or no one in their community has. So with that model in mind, and like I say, if you are more interested in that, please do have a look at the articles which are in the reference list, and I really recommend you do. We can then start to look at what's going on. So we can start to look at this oversharing and this undersharing and break it down into why it might be happening. So here are some examples. So remember we said capability is those factors which are personal to that patient. They're kind of internal factors. So maybe the patient is oversharing because they don't understand the purpose of your sessions or how CBT works, for example. They may have had more, let's say, open kind of counseling type therapies in the past. And so they come into a CBT session, which is more focused on techniques and homework and the present focus. And that's a bit of a shocker. And so that could lead them to overshare. It might be that the patient thinks that what they're telling you is relevant. They're telling you all of this stuff in really good faith that it's going to help them. And actually you're sitting there thinking, well, based on what we're going to do in therapy, based on our kind of model or way of working, maybe some of this isn't so relevant. Again, that's a capability factor which might lead to oversharing. It might be that they also struggle to concisely put their symptoms into words. So again, there's the best intent, best interest in giving you an overview of their symptoms, but they're just struggling to put them concisely into words. Opportunity. So again, these were those external factors. Maybe they don't have much social contact outside your sessions. It may be that you're the only person they talk to that week. And so their natural want and desire is to talk to you about everything and anything. Again, it's not their fault that that's happening, but it's potentially a reason for oversharing. And then in terms of motivation, it might be, do they actually want to be there with you? Do their goals align with what you're going to be doing in therapy? And again, we'll talk more about motivation later. But the reason I'm showing you this is because through conversations and speaking to your patient, if you can get to the bottom of what the barrier is, whether it's capability or opportunity, you can then start to work on that together. So if the patient is really struggling to put their symptoms into words, for instance, you might send them like an emotions wheel or something like that, or you might work on them, try and help them to put their symptoms into words. And that might then lead to less oversharing. It might be you then work on explaining to the patient how CBT or your modality of therapy works. And now because they understand that, there's less tangents. There's less maybe digging into their deep past when they know that the treatment is focused more on the present day and learning that kind of thing. So if we work out what the barrier, what the factor is, we can then work on it with the patient. I've also put together a few brief ones. And again, these are just some examples, but about why someone might be undersharing. So it might be that they can't see how this is relevant or helpful for them. And that's why they're giving you those one-word answers. It might be they don't understand how the CBT model or your model of therapy, if you're not a CBT therapist or PWP, applies to them. Or maybe at the bottom, this is quite a common one, especially for some minority groups where there's a different view of mental health care. Maybe they don't actually understand the importance or the need to share with therapy. They may think, again, purely in goodwill, they may think that if they just give you these really short, sharp responses, that's what you want. That's the information you need. They might not actually understand that we do need a bit more, and we do need them to talk to us about how they're feeling in a bit more depth. Some of the opportunity factors, which we mentioned earlier, might be that there's limited positive role models around or social support. And then again, motivation. So do they want to be in your session? And similarly with the oversharing ones, if you can work out why this is happening, you can then try and work on it with your patient. If they don't understand that they need to share in your sessions, you can have a quite frank discussion about that. And then that might then help them to open up to you in future sessions. So it kind of feels like common sense, but sometimes, especially in this kind of time-limited kind of back-to-back appointments where some of you are working, you can just feel like you need to just push through and just keep on going and let's just work through it and see what happens. And actually, within your early sessions, it could be really helpful to use a model like COM-B to get to the bottom of why this issue is happening, and then you can solve it as early as possible. So you might be able to solve this in your first or second treatment session, as opposed to getting up to, 6, 7, 8, and then having to request more because you are overrunning in each session.